this and we will share the screen. And today I sent y'all copies of the lecture notes, just the things that we're going to talk about, because we're going to talk about patient rights and privacy, big issues in healthcare. And of course, we will touch base on HIPAA a little bit. The patient rights, or as I put here, are a central component of ethical and professional healthcare practice. I think about this sometimes, with myself and my health concerns. I don't run up and down the street saying I've got high blood sugar or this, that, and the other. But I remember not long back, my stepfather was dying with dementia. I mean, dying, but he had severe dementia. He was seeing dead people and he was talking to them, and he worked for Pineland Lumber Company all of his life. And they had called all the old people back because the young people didn't know what they were doing. He was packing his bag, getting ready to go to work. My mother at the same time was suffering dementia. And family members were, I think on his side of the family, were wanting my mama to be ruled with dementia. So they thought they could put the trust in place and then they could distribute what they had. That was the goal. And one of the nurses there was asked about my mother by my stepfather's daughter. There's four on that side, four on our side. And the nurse told her, oh, she's got such and such level dementia and all of this. Well, that was a serious violation of my mother's right to privacy. But it could have had major consequences because those kids are still, they're trying to divide stuff now. Mama's gone, but still same type stuff. What can I get, and who can I walk over to get it? My mother had serious dementia, and by the time she died, it was almost a relief to see her step over where her suffering was over with. But she had a right to privacy. The nurse that shared that with the other family member had no right to share that information. That was private information, and it could have affected a whole lot of different things. So we're going to start talking about patient rights, patient privacy, actually things like what is a patient, what level are they required to be at in order to make a health decision and things like that. I mentioned three central essential patient rights: the right to privacy, the right to informed consent, and the right to access to care. So we've looked in the past, privacy is mandated by law. You cannot share the records. You cannot discuss the case. That just goes without saying. And anyone going into the healthcare field has to be careful about what they share about their patients. I pastored for many years, and I counseled a lot of people. And a pastor still, whether he likes it or not, might be caught by HIPAA. But I cannot imagine someone coming to me with a very personal issue, discussing it in private with me, and then hearing it discussed out in the public because I had said something. You can't do that. And privacy is essential right. Informed consent means they can't do things to you without you knowing it. I was watching television the other day with Zoe, and Zoe loves Beauty and the Beast because he likes Belle. He likes Belle. He thinks Belle is great. But it was kind of funny that the guy that was going to force Belle to marry him was going to have her father put away. And I was thinking about that. They're just going to arrest him. And back then, they just pick you up and haul you off, put you in the insane asylum till somebody got you out. That's not what happens anymore. You're entitled to informed consent. You have to be reasonable enough and cognizant enough of what's going on to give consent. But we don't have any more of that just pick them up and haul them off. In the United Arab Emirates, we went into, of course, the Arabic society, which is Arabic culture, which is different than the Anglo culture. But over in Saudi Arabia, women don't have near as many rights as they did, say, in the UAE. In Saudi Arabia, they have a group that will pick up. You can report a wife. You can report your wife for being disobedient, and they'll pick her up. It's called wife obedience training. And I kidded my wife. I said, "You better be nice to me, or I'm going to have you have the wife obedience group pick you up." And she said, "Well, if you do, you better be dead by the time I get out." I said, "I will be dead." They never teach you that. But think about informed consent, that they can't just do things to us because they want to do things. We have a right to know what medicine we're taking, why we're taking it. We have a right to know what care they're going to give us. We don't just go and check in the hospital and then blindly find out the next day that they took one of our kidneys or something like that. Informed consent, access to care. And we talked a lot in the last semester about access to care. And we're gonna share a few more ideas about that in this particular lesson. Let's go down to talk about patient privacy. Includes my medical records. What if there were not privacy for our medical records? Come on in, Gollum. What if when we went to say apply for a job, they could pull up our medical records? What if they could pull up our family history? There are some countries in the world that if somebody in your family has had mental problems, then they think that reflects on the whole family. It doesn't. I mean, that's individual. We don't know what's going to happen with genetics when we're born and all of that. But what if they could get our medical records? And they could say, well, you have more likelihood of having a heart attack than this person over here, so I'm not going to employ you. I'm going to employ them. Our medical records are private. Our medical records are not to be shared with big pharma or somebody else that has an interest. And think about insurers. Get your medical records without your permission. Employers get your medical records. There was a time back not many years ago where they were actually giving psychological batteries in some companies to potential employees to determine who it was that they might want to employ. And I think the courts took care of a lot of that because a predictive test cannot say exactly what you might do. I'm reminded, like in World War II, they turned down Audie Murphy because he was in the Marines because he was too short and too little, and then the Army took him, and he ended up being the most decorated soldier in World War II for his courage and his bravery in battle. You cannot make decisions sometimes on speculations. But what if they could get our medical records? That's why our medical records are private. I can imagine, back when my wife and I got married, I was 21 and she was 18. My mother was a holy terror she never liked any in laws. And what if she'd have been able just to go down to the medical doctor, get Sharon's medical records and the records of all her family and find out that she was distantly related to a guy that had murdered a family? Well, I would have stopped that because the Wallers hadn't got a good clean slate either. Neither did the Corbels. But those things we're protected from. Our medical records are our medical records, and we have to be very conscientious of them. Medical records are secured even more so than your educational records. HIPAA has much greater bite to it than FERPA. FERPA maintains the confidentiality of your educational right to privacy. I remember when I think I was about 30, 28, 30, no, maybe about 28. I was finishing up my master's degree, and I got a phone call from Stephen F. Austin. And my mother had come down there and told him she wanted my transcript. Well, my mother didn't pay for my education. I paid for my education. Matter of fact, they disowned me when I surrendered into the ministry, and they were very ugly about it. And she went down to see what I was doing with education, going to check my grades out. Well, if she had called me, I'd probably given her a copy of it. But she couldn't get it without my permission. And I'm enough like her that I said no, she can't have it. If she wants it, she can call me at home and I'll decide whether or not she gets it. Medical records are protected under law. And our medical records are not subject to just somebody going out and getting them. What if big insurance could get all of our medical records for an area and they could determine whether or not in that area there was a propensity to a certain type of cancer? So they would refuse to cover that particular cancer. Those type things are real world scenarios. And we need to be aware of it. Diagnosis. Have you ever been put on any medication for different things?
I've been on asthma medication.
Yeah,
Yeah, pump.
and got to have that little. I have to have that inhaler. She got on me the other day. You been using that inhaler? I told her the truth. No. Oh, you need to be using. I said, well, I hadn't needed it up to now. Now that last night I used it because this congestion stuff is blocking my breathing, and I was wheezing. But what if you went to apply for a job and they could pull the last year of medical diagnosis that you had been through? Your medical condition, your medical records, your medical diagnosis is private. It is not open to public review. And that's very important. Your treatment plans. We're guaranteed that we will not be discriminated against because of a disability. But the disability, if we choose to disclose it, we can seek uh, protection. But I know people that have disabilities that don't disclose their disabilities. They don't want anybody to know. I have a very good friend who suffers PTSD from having been overseas and in combat situations. He won't tell anybody that. Uh, he told me, he told a couple other people, but he's very private about that. He goes to work, he doesn't want anybody to know that he has that treatment. That's his business. And an employer couldn't get his medical records and his diagnosis and his treatment plan. Say they wanted to get that before if they were considering him for employment. That's personal information. Personal information shared during care. Sometimes you go under advisement by a doctor who will tell you different things. That's confidential between you and the doctor. And all of these things are private and they're protected by law because yes,
What if somebody has some medical condition? Let's just say they have like seizures, for example.
yes.
Are they required to tell their work?
No, they're not required to tell their work. It would probably behoove them to tell their work, to declare a disability, because if you have a disability and you declare that disability, you can receive reasonable accommodation. I had a young man that I pastored for many years. He was a dear friend of my son's, and he had asthma. And he wasn't telling anybody he had asthma. I mean, he was very guarded. I mean, he was Superman. He's not Nobody's supposed to know he had asthma. He went home with the family and he slept on the sofa. And during the night, he had a seizure and he rolled over and he died. He smothered. But now, if they had known that, it might have helped save his life. But nobody knew that, and they got up the next morning and he had fallen on the floor and he was dead because he had smothered to death in the night. There's a balance. You have to look at it from the person side versus the outside. The person side, they have absolute right to keep everything confidential. They don't have to declare anything. Now, in dealing with the outside, it might help the individual if they choose to disclose the medical condition that they have. But all of that is set up to keep a person from being being discriminated against because of a medical condition. I know in some countries, for if a person in your family has a mental illness, that they look down on the whole family. My father was mentally ill. He was a mean man, and he died separated from everybody, But just because he had mental illness doesn't mean that I have mental illness. It doesn't, there are some genetic things with mental illness that there may be cases that arise. But what if I went to an employer, say a church asked me to come preach in view of a call, so they pulled my family's medical records and found out my daddy was mentally ill and wouldn't consider me to be the pastor because my family had mental illness in it. That would be totally wrong. And that's what the law is set up to protect the individual from. You have right to privacy. You also have right to privacy in your educational records. People shouldn't be out talking, what you make in this class should be between me and you. You know that you can go down and look at your transcript with the registrar. That's fine, but I'm not. I would be violating your educational right to privacy if I talked about you getting a grade and you getting a grade to each other. That you're entitled to privacy. Back when I was young and I first went into college, that was before FERPA and HIPAA and all these laws were in place. They would post your name outside on the door and what you made on the exam. And everybody could see what you made on the exam. That was a serious violation of our right to privacy. So medical records, your diagnosis, your treatment plans, your personal information cannot be shared. Now, why is privacy essential? Well, it preserves patient dignity. I mean, there are some people that they're very embarrassed because of a certain medical condition they might have. I'm not able anymore to leap a tall building, and I'm not faster than a speeding bullet because I've had heart issues. I can't do what I used to do. And some people that really bothers them for anybody to know that. And there are certain medical conditions that uh, can affect people and affect their families. Uh, Privacy, of course, builds trust between patients and the provider. When I go to the doctor, I want to know that I can trust the doctor. I don't want to know that the doctor's out on the street corner telling, "Oh, Waller, yeah, I had to get on his medication because that sucker, his blood sugar was blah blah blah, and his cholesterol was here." That's nobody's business. That's between me and the doctor. Now, unfortunately, I signed and gave my wife full access to everything, and you know how wives are; they worry about your health, and she talks to them about that. But I trust my doctor. I want to go to someone I can trust. If I were going for counseling to a counseling provider, which is also covered under this, I want to know that they're not out talking what I'm telling them to somebody else. I want privacy and that I can trust them and I can depend upon their confidentiality. It encourages honest communication. Have you ever gone to the doctor where they give you the list of things? Have you ever done this? Uh, have you ever? And guys, I'm going to answer some of these things. Have you? They gave me one. Have you ever used marijuana? Have you had unprotected sex? Do you have multiple partners? I mean, all this type of stuff. No, I never used marijuana. That doesn't mean my sister didn't. I love her to death. She was a lot wilder than I was. I've always been kind of straight laced. But it talks about all these things. They're asking those questions for health reasons because certain behaviors put you at risk. They want to know simple things like, do you smoke? Do you drink? No, I don't smoke. No, I don't drink. I drink Diet Cokes. I guess if Diet Cokes might be worse for you than some of the other stuff. I don't know. I love that hot tea, and it's got sugar in it, which I don't need. But they ask you those questions, and answering those questions honestly can help them diagnose your situation. And if you lie, if you don't trust them, you're not going to answer them honestly. If they ask me, did you eat a bowl of Bluebell ice cream last night? And they're going to talk to my wife, I'm going to lie, because if they're going to tell my wife what I've been eating, and she's going to fuss at me, I'm just going to hide it. It is an issue. Trust, truthfulness, and confidentiality go hand in hand together. We need to be confidential. Hey, I don't know if you've ever thought about it, but as educators, we have a responsibility to report. As a pastor, I have a responsibility to report. I had a lady tell me one time, and she was about to tell me, and what she was going to tell me is about the abuse of a child. And I told her, I said, now before we begin any, and I didn't know any of that. I said, before we begin any of this, you understand that I'm legally required to report on many issues. And if you tell me I can't accept it confidentially, because under law, you look at like the abuse of a child. If a child is being abused and I'm a pastor and I find out about that, it is my legal responsibility to report it. I don't care how confidential they want me to be. And it turned out in that case, she told me anyway what was going on, and I had to report it. And the side is the guy got like 6 years in jail. I mean, and it stopped the abuse cycle for a while. There's the confidentiality is should be utilized in all cases except where the law dictates something else. And we have to be honest and upfront where law dictates something else in order to let them do it. And part of the reason that we have these strong confidentiality laws is to prevent the misuse of information. You can misuse information. I know a case where two kids ran for president of the student government at a community college. One student was probably much better student than the other one. The other one was very people oriented. Unfortunately, he wasn't very grade oriented. And a teacher got his transcript, found out what his CGPA was, and told all the students, well, he has a 2.0017 or something like that CGPA. That was a violation of his educational right to privacy. And it was done with malicious intent to stop him from pursuing a position that he wanted to pursue, like president of the student government. What if those things were done with medical records? We've seen in our political system a lot of back and forth about what medical condition they're in. And they do that because a lot of the top politicians in the United States are 100 years old and up. They're creeping around and all of that. But it's done to discount your opponent if you can show that they're not in good health. But what if they could go get their medical records? What if an employer, you had been ill for a month or two, and now you're out looking for a job, and your employer could pull a potential employer could pull your health record and say, "Oh, you were sick for a month, a few months ago. I need employers that can be at work." That's illegal, and that is discriminatory. And the reason the rules are there is to keep them from misusing it. And believe me, if there's a way to misuse it, somebody will figure out how to do it. Insurance, again, and insurance coverage has changed in the last several years, because when I was a younger man, they were gravitating towards even looking at genetic testing as to whether you were prone to something, and they wouldn't cover you for it. Now they call it a pre-existing condition. So right to privacy for the patient is done to protect the patient from the misuse of information. Oh, in the United States, the privacy is protected by the Health Insurance Portability and Accountability Act. We call it HIPAA. Oh, I went up to the hospital the other day. One of the members of our church was ill, and I thought that I would go visit her. She's an older lady and doesn't have much family. And Zoe and I drove to the hospital, and I asked for her room number because I didn't know what room she was in. Are you her family? Who are you? I said, well, I'm a member of the church that she goes to, and I think a lot of her thought, well, we can't give you that room number. That's HIPAA. Well, fortunately, I knew her daughter, and I called her daughter. What room is your mama in? She told me, and I went up to see her mother. But those are just they're protected now. That is protected information. If you go in a hospital as a patient, they may ask you who can come in your room. I've got an aunt that I guarantee you, if she came to my room, I don't want her let in. She's one of those flower children that burned her brain up on LSD.
The other day, my friend, her son
Yes,
got an accident,
yes,
and then they took him to the hospital.
yes.
And then she was looking for him, and then she couldn't find him. And the person that he crashes,
Uh-huh.
and that was giving him some support,
Yeah.
called her.
Yeah.
He told her, oh, he's in this hospital, it's everything okay.
Yes.
But they took him
Yeah.
to the hospital. And when she got there, they didn't let her go in.
Yeah.
But it's my son. No, but we cannot because he's more than 18, I guess.
Yeah.
She couldn't get.
Yeah, if that's like my mother asking for my transcript. If I had been 17, my mother could have got my transcript. If I was 19 and my mother could show that she claimed me as a dependent on her income tax, she could have got my transcript. But when I'm 28 years old and I'm on my own and they hadn't sent me anything, she had to have my permission. What happened with that is he was over 18. He's a legal adult. He has to say who you can release information to. I know, I laugh about that. I laugh about that, but I used to say of teenagers, go ahead and leave home while you're 16, while you still know everything, and you can fully support yourself. Don't wait till you're 18 and then you don't know how to do it anymore. But the HIPAA is powerful law, and we're going to say HIPAA has legal penalties. Now, FERPA is the Federal Education Right to Privacy Act. That's your educational records. There's not much teeth to that piece of legislation. Oh, if your father comes or your uncle and wants your transcript and they give it to them, yeah, they can get sanctioned for that, but there's not a lot of legal damage. But let me tell you something, in HIPAA, in health science, there can be a lot of penalties. And they're very serious about that. They have fined hospitals. People have won judgments against them because they violated their right to privacy. You never know in a family what's going on. Some families are very peaceful. My wife's family, her mama, daddy, her two, she's got a sister. They're the most peaceful family in the world. They just seem to knit together and get along. My side of the family is different.
Dark side.
It's the dark side. I guarantee you, just like the football game the other night. My aunt, God bless her, she's a pest. She is. I laugh. I tell my sister she burned her brain up using marijuana in the '60s or something, or LSD. I don't know, but so you may be in the hospital and you don't need the stress, and you want to be protected while you're under care. Many years ago, I was a pastor, and I guess it's been about 30 years ago. I went to the hospital to see a church member, and I had just gone to the church. I was just serving as an interim pastor, and I heard that she had gone to the hospital, and I went to the hospital room, and this old woman, she led the WMU and Women's Missionary Union. She was very faithful and believed in missions and loved people, and she's in a double room, and there are these people over there cussing and carrying on, sound like a sailor bar fight. And her poor old nerves just like that. I went down and I told them, I said, you need to move her. She's going to have a heart attack. Her heart monitor was acting up. She was so upset. They said, who are you? I said, it don't matter who I am. You go, I wasn't even related to her. But anyway, they went in there and they asked her and she said, I've got to move. And they moved her to a room where she could calm down. What if your family was like that? Some of my family is like that. Oh, if I get a phone call from my daughter, I will answer it if I'm in class. If I get a phone call from my wife, I will answer it. But if I get a phone call from my sister, I'm not going to answer it because I don't want you to hear her cussing every other breath. You know, what if you're in a hospital and you're trying to rest and they just let them in and everything? So you're in charge. You're in charge under HIPAA. It is your health care. It is to do what is best for you. Now you're expected to follow the doctors and why go to a doctor if you're not going to do what they want? But you still have the right to decide. Handling protected health information, storing medical records. See, they can't just handle your records like they handle another piece of paper. What if they left your medical record, just threw it on top of the desk and the counter and somebody else? Well, they're liable for that. They can be fined for that. Store your medical records so that they're not lost. They have to maintain an electronic version, a paper version. Their paper version can't just be stuck in a file cabinet. We're talking about fireproof file cabinets. Fireproof file cabinets that have at least 2 locks before you get to them so that they know that they're reasonably secure. They have to have a digital backup system. But what if somebody stuck my medical records in a file cabinet and there was a fire that night and it consumed my medical records? They have jeopardized my long-term health because the records of what I've already gone through would have been destroyed. When you go to a doctor now, the first thing they want is your medical records. They want to see. And those medical records, you have to agree to let them access it. You have to sign it. They get it. They store it in a confidentially secured location. And if they didn't do that, they would have liability, serious financial liability, and limit access to authorized personnel. Only those that have legitimate cause of needing to know what your medical records are. And here's some of the violations of these laws can result in legal penalties. Listen, when you get fined, you listen, don't you? When you get a fine, it registers. You ever got a speeding ticket? Now, but confess I must. I'm driving down the road. I've got a heavy foot. My kids were teenagers in the back seat, and I came around the corner, and it was a highway patrol. Lights come on, pulls me over. He comes up to the window. He said, "Did you know you were speeding?"
No.
I said, "Yes." He said, "Well, why were you speeding?" I wasn't going to lie to him. Yes, I knew I was speeding. He said, "Well, why were you speeding?" I said, "Well, I'm a statistician. I was going with the odds you wouldn't be here." And my son in the back seat, I said, "Oh no, he's going to take Daddy to jail." And the highway patrol started laughing, but he gave me a ticket. Now, let me tell you, that financial ticket, I think it cost me $70, $80, $90. I don't remember. It got my attention. I slowed down. Now I'm at an age where I slow down naturally. As you get older, you drive with the old people that you fuss at. We're poking around, while you're trying to get somewhere. But legal penalties, financial penalties can get somebody's attention, and that's why they put teeth to HIPAA. HIPAA has teeth. A violation can cost money. Loss of professional credibility, ethical violations, decreased patient trust. Suppose you're a medical counselor and word gets out that HIPAA has sanctioned you for talking about releasing records of your patients publicly. Now listen, if I go to get help and I'm getting counseling, I don't want anybody talking about it. If I need to talk about it, I'll talk about it, okay? That's Orlando slip by there. So, there's the responsibilities, for privacy are real in the health science field. There isn't any leeway. Well, I can slip it to you this way or hand their record that. And if you watch TV a lot, always enjoy on the crime dramas, the detective, I need their medical record. Well, son, you're not going to get it unless the court orders it or the person is dead. And then if they're dead, there's certain ways you can go about getting it, but they can plan on going to court to get your medical records because that is your right to privacy. It's not something you have to purchase. Now, healthcare professionals have to use secure record systems, share information only with authorized individuals, speak discreetly about patient matters, and provide private spaces for examinations and discussions. Um, I laugh when that one about private places for examinations and discussions. I had a great aunt. She was my grandmother's sister. Her name was Esther. And Aunt Esther she was always one of these people's always in everybody's business. Now she was a sweet person, but she wanted to know everybody's business. So Sharon and I had been married, I guess, about 5 months. And Sharon had maybe 6 months. Sharon started telling me, I want a baby. I want a baby. And I'd say, Sharon, we need time with just us before we have a baby. I want a baby. I want a baby. And I finally said, okay, well, we can have a child. She said, good, I'm pregnant. Okay. And so I took her to the doctor's office, first visit. My aunt walks in, my great aunt. And my great aunt says to Sharon, why are you here? And about that time, they called Sharon back for her medical checkup. By the time we got out of that doctor's office, we hadn't told a soul, but every living relative we had knew that Sharon was expecting our first baby, Amanda. And they should have been a little bit more cautious when they called Sharon back. But you never know who's sitting in the audience. And now I laugh about that. It didn't make any difference to us because we rejoiced when Sharon got pregnant. You find people that, if it's going to be a boy, it's going to be a girl, they throw a fit. I was delighted. It didn't matter to me, boy or girl. I just wanted a healthy child. And I'm very proud of my daughter, who is our oldest one. But provide private spaces for examinations and discussions. What if the doctor took you back and you could be overheard everywhere? Talking about your medical condition. I was at a doctor's office one time where a woman had gone back to talk to the doctor, and I'm in the booth beside. I heard the whole discussion. What she was there for is that her brother was an alcoholic, and she was wanting the doctor to give him a pill to make him quit drinking. Well, there is no such thing. But there was that loud conversation. And the doctor actually violated HIPAA. Now, HIPAA wasn't in place then, but would have violated HIPAA by having that examination in a non-private place where it could be overheard. Privacy extends beyond the paperwork, includes verbal communication, physical space, and digital records. So the patient's right to privacy is fundamental, and it's not negotiable. If you want to waive your right to privacy, you have to have a signed form. And listen, some of those forms, they want them notarized. There's somebody there that notarizes it as a witness. It's a serious matter in regard to a patient's right to privacy. Now, one of the other things we're going to talk about is informed consent. Would you want to go to the doctor and they take you back in the room and the next thing you wake up and your kidney's gone? I mean, yeah. I can't I can't imagine anything like that. But there are all sorts of science fiction stories about stuff like that. But you have to be told the purpose of the treatment. why are you doing this treatment? I'm doing it because your blood sugar's too high or your cholesterol or you have a murmur in your heart. Nowadays, they not only tell you the purpose of the treatment, but the risk and the benefits that it may bring. They may tell you that the likelihood of success with this procedure is 82%. What that means, 82 times out of 100, it's going to work. 18 times out of 100, it's not going to work. I have a friend that has a I've had three stents in that what they call the widowmaker artery. It's a main artery, main flow. I had a stent and a stent, and then it blocked between them, and they had to put a stent between them. And doctor was able to do that, but he has a blockage. They've tried to clear his blockage like 4 times, and they've been unsuccessful because the blockage has been there so long and it's hardened so hard, it's like a rock. It's what the doctor told him. And the last time he went into it, he called me and said, Rusty, I'm worried about this. I said, well, I understand that you're worried about it. What do you want to know? He said, well, you've been through this. I said, what did they tell you? Well, he said, well, they told me that the likelihood of it being successful was like 8%. I said, well, Kevin, that's something you have to decide. What's the likelihood if they don't do something that you're going to be fine? That's what I'm interested in. He told me you have a blockage and we have to clear it. And I went in and they cleared that blockage. And fortunately, he was successful. But they have to tell you the likelihood of whether it's going to work or it's not going to work. They have to tell you what the risk of it are, what the benefits to it will be, and are there alternative options. Back in the day, they used to do a lot of heart bypasses. And they had to cut you open and pull your ribs apart. And you can just imagine how you felt after they got through with that. And then they'd put a bypass in. Now they go in here, right here, they go up through your veins and arteries to your heart, and they'll put a stent in, which is a lot less intrusive. Is there a viable alternative to this surgery? My surgery might be such that I'm better off not to have it. If I don't have it, I'm going to likely live 5 years, and if I do have it, I may live 5 years. Okay, and then if they fail, I may be gone by dark. Okay. I've pastored a long time and talked with a lot of people through healthcare. One of my dear friends had one of those valve replacements in his heart that they did years ago. They used to do those valve replacements, but they wouldn't tell you how long it was likely to last. And when they did that valve replacement, they took a pig's heart, a genetically engineered pig, I'm sure, but they put that pig valve in his heart and replaced it, and it had a life of 7 years. And he asked the doctor, what happens when it wears out? And the doctor said this, when it wears out, it wears out, okay? You're gone. But he went into the surgery knowing the circumstances. Now, Urban was eating lunch one day, and I went by and said, hey, Urban, how you doing? I said, how'd your heart start? Oh, he said, that was marvelous. He said, my heart is doing good. He said, I'm feeling good, but he said, I have the strangest urge to eat corn on the cob. He was laughing about having that pig heart valve in him. So you have in the right to know the purpose, to know the risk and benefits, to know the alternative options and the consequences of refusing treatment. And it's your choice as a patient. You may refuse treatment. Now, we've seen a lot of legal wrangling about parents who've made choices for children. And sometimes the courts have had to intervene. There are some religions, for example, that believe that it it is unchristian to have a blood transfusion, and the child would die without a blood transfusion. The court had to step in. Some cases they've ruled with the parents, some cases they've ruled for the good, the doctors, for the good of the child. But ultimately, as an adult, it is your decision as to whether you choose to endure the consequences of the treatment or not. We probably all have known, or if we don't know, haven't known, we probably will know before we leave this world, someone that had, say, cancer. And rather than go through all of the treatments with a very small likelihood of living, they just chose to die in peace. I know a man that did that, and he was more worried about the consequences of how much that expensive treatment was going to bankrupt his family and all that, and he chose, he said it's not worth it. He said if we spend all that and it's successful, I might live another year. He said I'm ready to go home, and ultimately it's his choice. Now, the requirements to give a valid consent to do something are really threefold. The first of those is the capacity. Do you have the mental capacity to make the decision? Let's take Zoe just a minute. My autistic MR, legally blind werewolf child. Okay. So if they told him, Zoe, you've got to have open heart surgery, and you have to make a choice, you think he'd understand? Now, he's had open heart surgery when he was a child. Saved his life. He wouldn't be alive today had it not been for that open heart surgery. That's how bad he was. But the first thing is that you have the mental capacity to make the decision. As parents get older, they may lose the mental capacity to make a decision. I told you, my stepfather died. He had severe dementia, seeing dead people. Seriously, he was talking to people just like we're talking, and people that have been dead for years. Maybe he saw them, really. I don't know. It was about time for him to cross over. But he wasn't able to make a decision in regard to the treatment that he received. And it fell on my mother then to make the decision. And my mother's ability to do it was likewise questionable, but she made the right decision. But much longer, and her credibility, her capacity would have been challenged. She signed a form granting full durable power of attorney to my niece, and mother at that stage, her dementia was so bad. And my niece is a nut. And my niece, I just told my niece, look, you better work right, because if you don't, my attorney is going to challenge you. And I would have, because the issue is my mother's well-being and her care. And we were able to keep her under control. So the capacity to make the decision, and the decision is made freely without coercion. What if a person is forced to make a decision? Then that violates the requirement for valid consent. And then, of course, the patient receives clear and complete explanations. You have to have the information that it takes to make the decision. You're free to make the decision yourself and have the mental capacity that's required for such a decision. Communication and autonomy. Informed consent is just not a signature on a form. It's an ongoing communication process. Respects the patient's right, their autonomy, their right to be in charge of their health care, encourage questions, supports shared decision making, and requires clear, understandable language. My wife always gets mad at me because I go to the doctor and I talk to the doctor and I come out, I ain't got a clue what they said. And they can talk to her and they said that he's talking, what medicine do you take? I don't know, it's a pill about this long. It looks like that. He's got the list of my medicines. I say, pull them out and then we'll go through them. But to make a decision, a life-changing decision, you want to be sure that the person has the mental capacity and the information they need, and that they're not coerced to do that. And that's very important. We've all had family members that passed away, may have had medical care going on when it happened, but we want to know that they made their decisions and that they made it with the best way they could. My wife's father went to have a gallbladder removed, and while he was in the hospital, he had a massive heart attack and died. But he made the decision to go get his gallbladder removed. It was his decision because of his poor health, and he made it with the best information he had. But sometimes things go wrong. The last thing we're going to look at today is the access to health care. And we talked about that in the previous class a lot, that America has probably one of the best healthcare systems in the world if you have money. You have no money, and I'm not so certain that our healthcare system is that great. But some of the barriers that keep people from seeking health care are the financial limitations, lack of insurance. A lot of doctors won't take people if they don't have some sort of insurance. Your geographical distance. There are parts of this country that you can live in that a doctor is a long ways. Oh, I drove several years ago through part of New Mexico up in the north part, and I missed my road and I had to come back down another road. We drove for miles and miles and miles and miles and miles, and there wasn't even a street light that you could see. And I told Sharon, I said, how would you like to live out here and need an ambulance? Okay. And where do you go to hospital at in Albuquerque? I don't know. But sometimes geographic differences and language differences.
It's changing slightly though nowadays. They have like the virtual,
Thank God, virtual, yes. My daughter does virtual counseling for weight loss. And people are from all over Florida. That's where she lives. She lives in Texas, but she's licensed in Florida, and these are Floridians that do that. But I was sick the other day, so I could tell them I need to see somebody. And rather than as sick as I was, me trying to drive in, we logged in on the computer, and he talked to me about what I needed, and my wife could pick my medicine up. Okay.
they give you the prescription and then.
But it was viral, and the problem with viral, they can treat the symptoms, but a viral infection just gets you. I mean, but language differences are becoming much more pronounced. I know the old redneck right-wing view, you have to speak English, but Americans are, I think sometimes we suffer because of that, because we need to be bilingual. The more languages you speak, the better, the more you understand other cultures. And there are many people in this country that don't speak English. Go to a Navajo reservation sometimes. They speak Navajo. I think Navajo is a fantastic language, but my gracious, it took me 6 months just to learn the word Dene, which means the people. Okay, that's what they call themselves. Language differences, disabilities. If Zoe is hurting, he can't tell you what's going on. He's had an earache and an ear drainage, and I've been on him about it. Tell Daddy what's but his head is hurting. So he acts up, he acts differently. But you can't take him to the doctor and him say, I've got an earache right here. We took him to the hospital. My daughter did. And they looked at his ear, that was a couple of years ago, and they went in and did surgery. It was so bad. And cleaned out an infection. But disabilities can make a difference. And there are a lot of disabled people. What about disabled in a wheelchair and you can't get access? Those you can get. You're required by law to have access to a hospital but what if we had somebody with a wheelchair that was going to die if they weren't in here in this classroom? They couldn't get up the stairs, could they? Yeah. We'd have to move the class. discrimination is still, unfortunately, still alive and well. When you go into an emergency room now, they triage you. And that triage is intended to see whether you really need care or you need to go to a clinic or something else. And it would be very interesting to see the statistics of those that are sent elsewhere, because I would almost guarantee you that they would be a higher percentage of Hispanics sent elsewhere than a higher percentage of Anglos. I almost guarantee you that, and that's sad. But the barriers can stop you from getting access. And if you can't get access to health care, what do? Just suffer? That's sad. The role of healthcare professionals, of course, is advocate for patients, provide referrals, offering interpreter services, helping patients navigate healthcare systems, promoting equitable treatment for all patients. My daughter is a nurse practitioner. She finishes her doctorate in nursing this spring. She's helped me design these classes. I've kind of used her knowledge to help me. But you let her find out that a nurse is being discriminatory. She'll come unglued. She teaches nurses. That's your responsibility to treat all people fairly and equally. And it doesn't matter whether a person's wealthy or not. The issue of a triage is, do they need immediate health care? And that should be what drives it. And ensuring access, and it talks about, of course, improved individual health, stronger communities, public health advancement, and social justice. We never know. We never know with a kid what a kid is going to accomplish in life, do we? You see a little kid and they think, well, they're not worth much, but that kid may be the next great scientist. We don't know. And we need to treat all people with respect. Our ethical responsibilities to provide patient-centered care, maintain our ethical standards, build trust with patients, uphold professional integrity, and support equitable healthcare systems. Every person should have access. We all pay taxes, don't we? I don't care how poor you are, you're paying some taxes. You buy stuff, you pay sales taxes. You pay property taxes for where you live. Now, you may not be paying it, but the landlord's paying it, I can tell you that. So, we're talking about, as healthcare professionals, we need to see all people as valuable, all people as important, and be sure that we treat people with ethical standards. We treat them equally. I can tell you, I'm going to end, just almost through. But as a pastor of a church, I never cared what a person gave when they came to church. The issue was they were a person, and they mattered to God, and God loves all people equally. Some of the key takeaways from this: patient rights are foundational. Privacy protects confidentiality and dignity. Informed consent supports our autonomy, our right to make our healthcare decisions, and access to care promotes fairness and equity. Healthcare professionals must actively uphold these rights in practice. And in the set I sent you these notes because I'm not going to lecture without giving them to you. I just mentioned give you some questions to think about. Why is patient privacy essential for building trust in healthcare? Why would patient being confidential? I'm sorry, I'm struggling, but patient confidentiality is important in any occupation. If you go to your pastor and you talk to your pastor and you hear it talked out in the streets, you're in the wrong church. If you do that with your doctor, you're at the wrong place. You do that with your teacher. If you ever went with a child to go talk to their teacher, and that needs to be confidential. It's important, but medicine doubly so. And what barriers to healthcare access exist in today's system? And you're still talking about distance. The digital world is helping with that. There are some places that are so isolated that they're trying to recruit new graduates. You come out here and practice for us 5 years and we'll pay off your student loan $500,000. And so, that's how bad it is. So how can healthcare professionals advocate for equitable care? You just have to treat all people the same. I'm a teacher. I've been a teacher most all my life. I've pastored longer than I've taught, but I've taught for forever. I surrendered to preach in 75 and I started teaching in 83. So they're both been there a long time. But one of the fundamental things that I've discovered is how you treat people. All people need to be treated the same, equally. And I think the Bible teaches that. I believe that that's fundamental to the heart of God, that all people be treated fairly. God so loved the world. We're all God's children. And that's fundamental to any profession that we go into. So with that being said, I'm gonna disengage the recording. I hope I'm gonna disengage the recording. I'm gonna try to disengage the recording, and I will post this out on YouTube if you want to watch it again.